This will be a brief review on the things that you need to study for your test too. And I will put a transcript for this online as well. I'm not going to go through every single definition. Some are not even defined on here, but okay, for test 2, you'll have to, I'm trying to get this here. Okay, first, look over all your homework. Homework questions have a way. Those are the ones on Blackboard, the multiple choice questions. They tend to come up on your test. Questions at the end of your chapters, your relevant PowerPoint, and your objective sheets that you've been working hard on, and then listen to the 3 online lectures in addition to this one. Okay, bone anatomy, a few definitions. Okay, diaphysis is the shaft of the long bone. Epiphysis is the end of the long bone. Epiphyseal plate is your growth plate. Periosteum, outer covering of bone. Osteoblasts, build bone. Osteoclasts, break down bone. Endosteum is the inner lining of the bone. Hematopoietic tissue is like in your red marrow, and red blood cells are made here. Well, all blood cells are made here. Osteogytic cells differentiate into other bone cells. Osteocyte is a mature bone cell, and it should say osteon. I'm not sure if it does or not. I can't quite see it on this little tiny screen. This is the structural unit of compact bone. It's also called the Haversian system. And trabeculae is honeycomb-shaped structures in spongy bone. Osteoid is the organic matrix of bone. Hydroxyapatites are the inorganic portion of bone. Take up about 65% of the bone. Okay, now we still have more terms. Ossification is bone formation. Bone starts from hyaline cartilage. Now, I'm not sure why it says know what anatomical position is, but you should know that for sure. Sharpie's fibers are the fibers that hold the periosteum onto the bone. Now, compact bone withstands great stress, torsion, and it's made of a series of Haversian systems. Little random facts here. Facial bones, especially your nasal bones, your turbinates, warm and humidify air as it goes through these nostrils. Sinuses decrease the weight of the skull as well as resonating the sound of your voice. Flat bones develop from fibrous membranes. Long bones develop from hyaline cartilage. Red bone marrow contains hematopoietic tissue. Yellow bone marrow contains fat. Bone grows in length at the epiphyseal plate. It's called interstitial growth. It grows in width at the periosteum. Bone growth is stimulated by growth hormone. Excessive growth hormone causes gigantism. Deficiency of growth hormone causes dwarfism. Okay, the epiphyseal plate is closed by sex hormones. So initially, the sex hormones, estrogen and testosterone, when a person hits puberty, cause a stimulation of bone growth, and then the growth stops because the plates are closed. Males will continue to get thicker, broader bones, but they won't get any taller once those plates close. Okay, regulation of blood calcium. Now, bones are essential to keep your blood calcium levels at an ideal state. If your blood calcium level is way too high, you die. If your blood calcium level is way too low, you die. Either way, you're dead. So it has to be kept exactly right. Parathyroid hormone is released from the parathyroid glands, which are attached to the thyroid gland, when calcium level becomes too low. Parathyroid hormone causes osteoclasts to resorb bone and break down bone and release calcium into the bloodstream. Calcitonin inhibits bone resorption when levels are too high. Now, these are going to come from the parafollicular cells in the thyroid gland. You can live without your thyroid gland if you get thyroid hormone. You cannot live without your parathyroid glands. If your calcium level is too low, you're going to get neuromuscular issues, including cardiac issues and death. Calcium levels are too high. Initially, you may get deposits of calcium in blood vessels, kidneys, and other soft tissues. But if it's extremely much too high, it's one of the now things. You just die. Now, bone remodeling is affected by mechanical stress. This is one of those use it or lose it things. Wolff's Law says that the strength and the bone growth is directly proportional to the amount of stress put on the bone. So if you quit walking, your bones are going to shrink in your legs. Now, bone disorders, osteomalacia. Bones are not adequately mineralized. This is in adults. Rickets is the same disease, but in children. The bones are not adequately mineralized. And you'll get bow legs, knots around joints, pain. Causes of both these syndromes, osteomalacia and rickets. It could be a calcium deficiency, a vitamin D3 deficiency, lack of sunshine, which unless you take a D3 pill or drink lots of D3 fortified milk, you're not going to get D3 if you don't get some sunshine, or a calcium phosphorus imbalance. You must have at least 1 part calcium for every part phosphorus. If you don't, you're going to have a relative calcium deficiency. You can have a 2-to-1 calcium to phosphorus ratio and you'll be good. But the calcium must not be less than the phosphorus amounts. Okay, I'm not going to run through each of these particular terms, but I am going to mention osteoporosis. Who gets it? What causes it? Generally, it's in older people. It's in women because men continue to produce testosterone, and sex hormones cause bone to lay down, increases bone strength. So males are usually spared from it. Females get it because they quit producing estrogen. Asian and Caucasian women are more apt to get it than African American women because the African American women have genetics that produce larger. Also, calcium deficiency, lack of exercise, calcium phosphorus imbalance, all these can cause issues with it, with osteoporosis. I'm not going to go through each of these definitions. These are for you to look up. I'll look at this one. Osteogenesis is formation of bone. Now, intervertebral discs absorb shock and allow the vertebral column to remain flexible. We have 7 cervical vertebrae, 12 thoracic vertebrae, lumbar vertebrae, 5. Let's see. Okay, this I may not have gone through in the initial lecture, so this one's worth looking at. A male pelvis versus a female pelvis. If you see the female, you have a much wider pelvis here, whereas the male, you have a steep angle and it's not as wide. That's to allow a larger birth canal. Okay, this is bone marrow donation is often collected from the pelvis specifically from the ilium. Now, articular cartilage is going to be hyaline cartilage that covers the opposing bone surfaces and protects the smooth surface for joints to move. Synovial fluid is fluid within the joint cavity, contains hyaluronic acid. The articular capsule is a joint capsule. Menisci are articular discs. We have one meniscus, two menisci. These are in the knee. Bursa are flattened fibrous sacs, synovial membranes, and they're filled with synovial fluid. Bursitis is inflammation of the bursa. A tendon sheath is an elongated bursa around a tendon. Ligaments connect bone to bone. Tendons connect muscle to bone. Okay, just a couple more pages here. Okay, now with muscle, we have an origin and an insertion. Origin is the muscle's attachment to the immovable bone. The insertion is the muscle's attachment to the bone that moves. Flexion is decreasing the angle of a joint. So if this was an arm here, and that's our hand, blink, 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 blink. He only has 3 fingers, 4. Okay, as he flexes that more, now we have it flexed. Okay, we have decreased this angle. When we extend it, we've decreased this angle here from that to that. Extension is just stretching that arm out, so it's just the opposite, just the same basic thing. Abduction, moving away from the body. Adduction, moving things, limb towards the body. Supination, turning your hand up so soup will stay in it. Pronation is turning the hand down. Rotation is twisting. Now these got well defined out in the actual initial lecture, so I'm not going to go back through these. How many bones are in the carpus? Well, we have 8. How many in the tarsus? Let's see. Calcaneus, talus, navicular, cuboid, let's see, medial cuneiform, intermediate cuneiform, lateral cuneiform. So I suppose that's 8 again. Okay. Now, you're going to want to look through the types of fractures in your PowerPoint. And I'm not going to go through these right now because I haven't got anything on the notes. Diseases of joints. Arthritis is inflammation or degeneration of a joint. Osteoarthritis is wear and tear arthritis. Rheumatoid arthritis is an autoimmune reaction where the body attacks itself. Gout is inflammation where uric acid is deposited into a joint. You have to have an inflamed joint to start with, and then the uric acid levels are increased. So some people have a tendency to get this uric acid increase. It's made worse by alcohol, sardines, eating liver, kidneys, beef, drinking beer, especially beer. Okay, Lyme disease is a disease spread by ticks, specifically of the Ixodes genus. Borrelia burgdorferi is the specific disease, and one needs to catch it early when you first have a rash rather than wait until it is infected. I'm going to let you look these up. Let's see. That's all I'm really going to look at, I think. Oh, this one I will mention. The zygomatic bone is called the cheekbone, and it specifically helps give your face the shape that it has. This is a complete review, and there's a few things you might want to look up. I'm going to put out a transcript of this and the same sheet I'm looking at. But if you'll listen to the 3 lectures, go through all the things I said, you should be fine on the test. Thank you.